Well, it's still New Day on Signature Television coming your way this morning. Well, this is for you ladies and gents. Have you ever had the situation where you felt you needed to have a conversation with someone you had a connection with, and when you came close and they opened their buccal cavities, well, meaning to say their mouths to talk, and from their dentition to the aroma, for lack of a better word, that oozes out from their mouth, you'll quickly put away. Well, today we are talking about oral health, with particular, we are niching it down to oral prosthetics and cosmetic dentistry. I know you've never heard those before. Well, stick around. Today you are going to hear everything you need to know about those. Well, we have someone in the studio to do justice to this topic. Favor Ikechukwu is a dental practitioner here in Enugu, and he is right here live in the studio to tell us all we need to know. Good morning.
Good morning to you.
How are you?
I'm doing well. And
when you walked in, I noticed the blazers.
Thank you so much.
Looking good. Love the color. Love the packaging.
For me, it's the tie. I always appreciate ties because
Thank you.
I love ties.
Yeah. Beautiful. But a guy with a floral tie, is that a statement? Or
I'm so in love with multicolors.
Wow.
Yeah.
No, we can't tell.
Color blend is actually very good.
Multicolor.
You look really good. Okay, so let's get into the meat of the matter.
Okay.
So we've heard about cosmetic surgery.
Yes, plenty times.
We've heard about normal prosthetics for the limbs.
Yeah.
But we've never heard about cosmetic surgery. Cosmetic dental.
Dentistry. Yes.
Yeah.
Cosmetic dentistry.
Cosmetic dentistry and oral prosthetics.
Oral prosthetics.
Please tell us, what are those?
Okay. Cosmetic dentistry, oral prosthesis. When you bring the both of them together, you're talking about dentistry at large.
Okay.
But before you start talking about cosmetic dentistry and oral prosthesis, you look at it from the point of the branches of dentistry. Because dentistry is a body that covers all of this. It covers the prosthesis, it covers the cosmetics. But when we are looking at the dentistry on its own has three branches. We have the preventive, we have the restorative, and we have the surgical aspects. Now, when we now want to look at it from the cosmetic area, we have to start looking at it from the restorative part of it. And the restorative part of it also covers the oral prosthesis. Now, when we are talking about cosmetic dentistry, we are talking about the appearance of the teeth, how someone smiles, how how the teeth looks. A lot of people who go out there today, especially most of the celebrities, you see them with white teeth, you see them with very
perfect
white
dentition.
teeth, perfect dentition. You think that was how they came into the world. No, it's not true. All of these things are as a result of the cosmetic dentistries. You see somebody who is having a fluorosis. There are some persons with some discolored, dentitions. Maybe some of those people who were born in the, in the northern part of Nigeria, who maybe as a result of excess fluoride in their water, and the mothers takes it during, gestation period, and as a result of that, when the child, is brought forth, during the period when the child starts, erupting the tooth, it affects the child. So at that point, the child starts having some discolorations. And this discoloration continues until the child grows. Even after the mixed teeth falls off, for the permanent one to erupt, it continues like that. So for someone who has money and who wants to go into the global space, and you now start looking at it, what do I do to, this discoloration is really affecting me? That is where cosmetic dentistry comes in.
Wait, so coloration of teeth has nothing to do with the amount of times I brush my teeth?
No, it has something to do with it. Discoloration of teeth most of the time could either be as a result of excess fluoride, or could be as a result of
DNA?
No, not just DNA. Excess fluoride could be as a result of it. The kind of drug the mother takes when she is pregnant, like testosterone, can be as a result of it. Or some persons who take a lot of coating, Milo, takes a lot of this chocolate. It affects the teeth.
But for the records, tetracycline has been banned, right?
I wouldn't know about that.
Okay.
I wouldn't know about that, but I know for some persons who have discoloration of teeth, majority of them, or few number of them, could be as a result of the testosterone the mother takes during the pregnancy stage. Or for some of them who are coming from the northern part of Nigeria, the water there is not too good. So they have excess fluoride in the water. So when they take in the water during the gestation period for the mother, it affects the child. From the fetus stage, it tends to affect the child. So when the child grows up, you discover some brownish patches all over the teeth. And at that point, when you say you want to be a celebrity or you want to go into the global space, you can't go with such kind of dentition.
Okay, so I get cosmetic dentistry, but what are oral prosthetics? Because once you talk prosthetics, I'm thinking of artificial additions.
Yes.
So what are they really?
Yes. Cosmetic is one part on its own that talks about the appearance. And that's why I had to talk about the discolorations and all of that. But when you're talking about oral prosthesis in this point is a case where we have a lot of prostheses. We have limb prosthesis for the limb, we have for the hands, we have so many. But the prosthesis we're talking about, oral prosthesis, has to do with the oral cavity. The oral cavity and other parastructural parts.
What does that mean? Of
the body. It has to do with the eye, it has to do with the nose, it has to do with the ear. That's the parastructural part. But when we want to just marry it down to the oral cavity, we have to start looking at it from patients who have lost their tooth. You agree with me that 65% of people who walk around go to their business and their work. So many of them are wearing artificial teeth, which is called a denture, and it's also called a prosthesis. But you see them smiling very, very beautiful, but you don't know what they are wearing is not the natural teeth. So someone can lose the teeth, maybe due to accident, due to poor hygiene, due to one situation, fight and all of that. And instead of carrying it about, there are situations where it can actually be solved. At that case, that's where oral prosthesis comes in. Someone can have an accident with the eyes. We have a patient, some time ago, have an accident. One of the eyes was maybe as a result of, the surgery. They removed the eyes because the eyes was damaged. The patient was using one of the eyes. So someone had to recommend the patient, you can actually fix an artificial ocular prosthesis. At that point, we had to fix an ocular prosthesis that has a replica of the standing one.
No, you're talking eye.
Yeah.
You guys make prosthesis for the teeth and for the eyes. It's still part of your expertise?
It's still part of the expertise. All of this covers the restoration part. So, but because we are talking about the oral prosthesis, the oral prosthesis now has to do with the artificial teeth, has to do with the mouth guard, has to do with the appliances, the braces.
Braces.
The braces has to do with the orthodontics. There are some persons who have a line occlusion, who cannot smile because they're having overcrowded dentition. And because of that, there is need to correct it. There are some persons who the primary tooth, that's the milk tooth, couldn't fall off at the right time it's supposed to fall off. So the permanent one will have to now look for a space to start coming out. Because of that, there will be overcrowded dentition.
Okay, so what are the most common cosmetic dentistry procedures and who typically seeks them out?
Okay, our common cosmetic procedures, we have veneer.
Okay.
We have veneer. And one person, Ronaldo, is one person who uses veneer.
I was going to say Ronaldinho.
No.
I was going to say Ronaldinho. I was actually getting to that.
Ronaldo uses veneer. If you follow Ronaldo when he started his career in football, the way his dentition is now, looking very whitish, that was not the way it was before. They had to do a veneer. That's a cosmetic procedure. They had to do a veneer for him. Some people will do a veneer. Some people could decide to go for a tooth whitening.
Okay, so explain what a veneer is.
Now, veneer is a procedure where, okay, let me start from the tooth whitening. Tooth whitening, someone might have a fluorosis, like coming from a place, coming from a place like from the knot, where you take in the waters are not too good and it affects the teeth. And those teeth, those discolorations are not extrinsic, they are intrinsic. They are on the inside from the blood. If it's on the outside, it's extrinsic, that you can do 1 or 2 washing and it goes off. But because it's from the blood, it's from the inside, you can't just wash it and it goes off. That is where you have to ask the patient, okay, let's do you a scaling and polishing first. The scaling and polishing is a tooth washing, a professional tooth washing. They scale, remove some of the calculus. There's some yellowish stuff around the interproximal space, those yellowish stuff, and those things are the things that causes the mouth odor, which is called the halitosis. So they remove those things because you can't be doing teeth whitening while those accumulations are there. You have to do the scaling and polishing first, then you now fix the patient for a tooth whitening procedure. That tooth whitening procedure, that you do that, when that one is done, maybe after every 6 months, the patient can come for a review. That's for tooth whitening. For the veneer, that aspect has to do with, a composite. You create a lay. You put a layer, depending on the kind of shade, the shade of white the patient wants. You fix it on that patient's mouth. It's like a cap. You cap it on top of the teeth. It's white. It could be there for as long as the patient eats with it, the patient does everything with it. It doesn't affect the patient.
Comfortably?
Comfortably. Just like, imagine, Ronaldo using it. And a lot of persons, a lot of celebrities who are into media who also use it too.
Okay, so you've said a lot of things, including scaling, polishing.
Scaling and polishing.
And scaling involves trying to scrape off excess
accumulations,
calculus, beautiful.
Yeah.
Now, are there any possibilities that there could be infections, based off of some of these procedures on a patient's teeth? Are there any kind of consequences, maybe after the patient was worked on, after a while, the patient developed some kind of infection around the gums?
Okay. Yeah, there could be some little, not really infection.
Is it like the body trying to reject
not really
something that is not indigenous, some kind of an autoimmune response or inflammation?
I think I understand what you're trying to say. Now, let me use the word tooth whitening. Before you undergo the procedure for tooth whitening for a patient, the first thing to look out for is to ensure that the oral cavity, the teeth are healthy. You can't do a tooth whitening on a tooth that is not healthy.
How do you know if a tooth is healthy?
Yes, you have to check the tooth. You have to possibly ask the patient to go for an x-ray. The patient goes for an x-ray, you look at the teeth, there's no cavity, none of the roots are exposed. Because if any of the roots are exposed, the tooth whitening involves, you have to use a laser curing light, and those laser curing light involves a rays of light. So if there is any exposure of any of the roots, the patient will experience a very high level of sensitivity, which is not good. The patient cannot smile, breeze cannot come into the patient's mouth, some shocking sensation. So this has to be looked into. You look into it, you ensure that, okay, this teeth, you palpate the tooth, ensure none of the teeth are bad, no pain, either internal or external, no pain, no cavity of any sort. And when you look at it properly, and the patient confirms that there is no pain.
Okay, let me paint this picture for you so that you understand exactly where I'm going. Now, for people who carry out surgeries, right, they give prophylactic antibiotic treatment before the patient goes in, although it's being discouraged, but it's still in practice. Now, I'm saying this is like a mini or a minor surgery of some sort. Now, is there any prophylaxis? Because you could, in the process of trying to scrape off a particular part and probably cause some kind of abrasions on the gums.
That's true.
And with that, if it's not properly handled, the infection could occur. I'm just going through the process of infection. Now, have you ever experienced that kind of scenario, and what were you able to do to?
Yeah, it happens. It happens. Okay. Like the scaling and polishing. The instrument we use for scaling and polishing is usually an ultrasonic scaler.
What does that mean?
It's an instrument or a machine, so to say, used to scale off, because the calculus in your mouth, your toothbrush cannot remove it.
Sure.
Even if you're using the hardest toothbrush, you can't remove it, because it doesn't just start. It starts from a plaque to a calculus. So at that point, you need a scaler. That's where the ultrasonic comes in. It vibrates on the on the tooth.
And dislodges.
Yes, and dislodges them. So in the course of doing it, and that's why it's very important for a professional to handle it. If a professional doesn't handle it, the patient can have some gum laceration. And when the patient has some gum laceration, it could lead to bleeding. At that point, that's where you have to now ask the patient, okay, give the patient some post-operative instructions. When you get home, this is what you're supposed to do. Get a vitamin C, get some fruit, get a hot water and salt exudation. Use it to gargle for 1 week to ensure that any form of infection that will want to come up, because there's already some of the gum already exposed. It will help, maybe with a little antibiotic to help the patient.
So let's talk a little bit about price. How expensive is it?
Price. Wow. Cosmetic dentistry is not for
the poor.
It's not for the have-nots.
It's the way he tries
Guys,
to
just try to sound politically correct.
Yes.
It's not for the have-nots.
Because every time he said, if you see the celebrities, if you want to go to global space, I say, hey, let me ask how much.
No, it's not for the have-nots, but it's not like people can afford it. You can afford it based on what you're projecting yourself to.
I think we're actually looking for numbers, so you can give us like an average.
Okay, let's say for a number, let me use from 1 to 10. We can, from 1 to 10, we can get like 1 to 4 who come for it.
What we're saying is the amount.
The ego.
Assuming
the
after
cost.
this interview, I want to
like
have
just
my,
want to do a little bit.
you know, since we are going on a global.
I know, right? So I want to smile and then confuse
what should I budget before coming to meet you?
Okay. Now, if you're looking at the budgetary aspect of it, you'll be looking at it based on the location you're going to.
Okay.
Like from where I work for the government and also for the private. I work for Federal University of Allied Health. We have a clinic there, and also for High Smile Dental. Now, for the government, the price for the government is quite different from the price for the private. If you're coming for the government, like you want to do, scaling and polishing, you can pay, if you get your card and your consultation fee, you can pay, 5,000 to 7,000 for scaling and polishing. Yes. But if you're going to the private, you should be budgeting 15,000 to 20,000.
What informs this huge difference in pricing?
Yes, because the space. Space is one of the factor.
So the space will help me feel better.
If you're going to a private clinic, the comfort you get there and the comfort and the preferential treatment you get, you can't get it with the government. Like for the government where I work, if you have to see a doctor, you have to be there as early as 6:37. And by that 6:37, you already have about 20 to 30 persons on ground. So they give you your number before it gets to you. If someone is having a pain, you're almost going off.
Okay. Yes. So let's assume
ladies
that
first after the guys.
Ladies first.
After the guys.
No. I'll be a gentleman. So go ahead.
Okay, Favor. So I have this in mind to ask you now. Can someone be born with a perfect dentition? White, perfect dentition. That is one. And then secondly, we've heard from some quarters that it's actually there are long-term consequences of teeth whitening. In fact, I've had that conversation with some people, and they're like, don't leave your teeth the way it is.
Okay.
Don't. So just take us through, that thought. Can people be born with perfect dentition? And if people want to go for teeth whitening, are there long-term consequences?
Okay, for people being born with a perfect dentition, I would say yes. These things are genetics. When you look at your father, if your father has a white teeth, your mother has a white teeth. Let me not say the father and the mother having a white teeth. Maybe either of them have a white teeth. There are gross tendencies that you might be fortunate to having it. And when you have it, the white teeth can be there, but there are possibilities that you keep growing because of the intakes, the things you take. The shade keeps reducing. You might come up. You might be born with a shade A1.
Oh, there are different
there are different
gradations.
There are different shades of it. Different shades of white.
Oh boy, which shade is your own?
Can you tell by just looking?
Yes.
Which shade?
He's shade A3.
And I'm
yes,
shade
A3.
what?
You two, you are A3.
Yeah,
no, he's like A2, you are A3.
So
thank you.
What are you feeling like?
Because his is more whiter than yours.
Whiter than mine.
Yes.
Wow.
He's 2, you're 3.
Wow.
Yes.
So what are the other grades?
Yeah, they have A4 for people who smoke.
Oh.
They have people who take bitter cola. A5.
Wow.
All of them are just in A. No, there's no B.
They have B1. It's still white. They have
The human being
C1.
has B. Wow.
C1 is still white.
Okay.
C2.
But
as it keep going, the shade keep reducing. So for someone who has a very brownish teeth, we still have your shade. We still have your shade. So that's why when someone lost it, if someone has an accident and maybe the person lost 1 or 2 teeth and you want to replace it, most of the time the patient will say, can you give us the color
of my original
original teeth? We'll tell the patient, don't worry, we'll have a shade for you. We just get a shade guide. We have a shade guide from 1 to 20. So those shade guides, you just look at it, you know which shade fits the patient's natural teeth. So that when the patient is wearing it, it's going to look natural.
Obvious, yes.
Nobody gets. That's why I said there are a lot of persons who walk around who are using the oral prosthesis, but people don't know. Except when they remove it and show you, you know this is a prosthesis. I have a patient, she's married and she's been using a denture, that's the artificial teeth, for about 9 to 10 years. But the husband is not aware. Yeah, the husband is not aware. So one of those days, I don't know what she was doing, and it broke. So she had to run. She started calling me. It's been a long time I did it for her, and I don't have the number again, and this number keep calling. I had to pick. The next thing she said is, where are you? Where are you? Where are you? I said, who is this person?
I don't even want to go to the details of this one.
She said, where are you? Where are you? I said, what is the problem, madam? She said, I want to see you. Just tell me where you are. It's your patient. I had to ask her to come. When she came, she said, I need it today. Any amount I will pay. I said, what is the problem? Then I asked her, is your husband aware of this thing? She said, my husband is not aware.
Sounds very serious.
Very serious.
Very serious.
Now she's in the kitchen cooking, and she wanted to bite something, and all of a sudden it just broke. And she had to follow through the back door because the husband is inside. You know, things happen. I don't want to go into it.
Please.
Well, okay. Just give an advice because of time. We really have to go now.
No, before he gets to the advice, please tell us about golden tooth. There are people, especially those that go on Hajj. You see them smiling. You see either a silver tooth or a golden tooth. Yeah. What does that? I mean, how
is there anything special?
Nothing special. They just still for cosmetics.
And it doesn't have any effects.
It doesn't have any effects. People do it. Just they want to look different.
How do you care for your dentures?
Well, denture, you ensure that you keep it clean at all times.
So once you sleep, you remove it.
Once you're sleeping, you look for a container, a very clean container. There must be water inside. It is either the denture is inside a container of water or it's in your mouth, because it works with water. Okay. So once it's not in your mouth and it's not inside the water and you keep it out, there's a possibility when you want to put it, it will not fit again. Okay,
I'm pretty curious, because I'm using my imagination now.
Okay.
I don't know, how is it just the crown, or it comes with something that can glue to the gum?
Yes, it comes with something that can glue to the gum.
So it comes with a crown and something that can glue to the gum.
But that's the temporary one. They have the one that is just the crown, the permanent one. It doesn't have any other attachment, just the teeth on its own. That one is the permanent, is the fixed one. They call it dental ceramics.
Would you advise children to go for, because there are a couple of children I've seen with plaques on their teeth. Would you advise a child to go for plaque removal, or what would you advise? Scaling and polishing.
I think the first thing I will advocate for is for parents to look out for their children's oral cavity. It's so bad.
The thing is that these plaques can form even with good oral.
No.
I've seen kids from very clean homes, but they still have one child might have, the other one might not have. I've seen those cases.
Yes, when you look at it, when you see it that way, that means the mother there's a level of negligence on the mother's side. Sometimes parents just feel, when they look at their words smiling, the teeth is white, they feel the child is okay. Your teeth is white doesn't mean it's clean. The teeth can be white, but it doesn't mean it's clean. So that's why once you observe any of those, sometimes there might not be calculus, those yellowish things, but when you use your flux, and just in between, you see something that looks like a butter. That's when the calculus is forming.
All right. Favor, thank you. Time. But before you leave, just in 1 minute, how should I care for my teeth?
Wow, a lot is actually involved in caring for the teeth. A lot is actually involved. But first of all, the first thing is take plenty of water.
Plenty of water.
Amazing.
Take plenty of water. People don't take water. People eat, sometimes they don't take water. We are all part of this. Take plenty of water and visit your dentist twice in a year. If not for anything, come for the scaling and polishing.
Thank you very much, Favor Ikechukwu. Because of time, this is all we can take. Thank you. We really appreciate you for coming.
Thank you.